My name is Marlo Ball, and I'm a veterinarian. September is Senior Pet Awareness Month, and so I just wanted to take a minute to visit with you about senior pet care and things that we need to watch for and what to expect as our pets get older. I think a common misconception is that our pets are able to tell us that they're painful. I have a lot of owners who expect that their pets will vocalize or show very obvious signs of distress when it comes to signs of pain, arthritis pain. And unfortunately, a lot of the signs of pain and arthritis in senior dogs may be a lot more subtle than that. They may be reluctant to jump on the furniture, reluctant to jump into the car. They may have stiffness when they wake up in the morning. They may have bad days on colder days as the weather gets colder. They may limp, and that limp may be worse or better on some days. So, recognizing arthritis pain in our pets is going to require some involvement from our owners. Your veterinarian will do a physical exam, and one of the things that they're going to look for is range of motion and possibly crepitus in the joints. Crepitus is a sign of arthritis in a joint, and it actually feels like popping or grinding. I'll often feel that in knee joints or hip joints, and I'll also find decreased range of motion, which is where they're not able to move the limb in the normal range that they should, or I may have pain on extension or flexion of the joint. These are things that are important to work with your veterinarian to discover during an exam. So what do we do if we find signs of arthritis in our older pets? I think a really important thing to consider and to keep in mind with our senior pets is that if you don't use it, you lose it. So if our pets are experiencing pain, they may stop being as active. So now they're not using their muscles the way that they used to, and that causes them to lose a lot of muscle mass and a lot of muscle strength. And that is a vicious cycle where now we've got a large breed heavy dog who's very weak in the back end and may not be able to go upstairs, may not be able to do the normal activities that a dog should do, and it will progress over time to the point where the dog is not able to stand or not able to go outside to potty in a natural manner, and that's when we really have to have a conversation about quality of life. So if we know that arthritis will progress in this way, what are the things that we can do to try to delay that progression and give them the best quality of life that we can? I am a big believer in multimodal pain management, and what that means is that we're going to give a combination of different medications that work in different ways. I have some owners that are reluctant to throw a lot of meds at their senior dogs, and I understand. And I think instead of having a cookbook recipe, we really have to set up our plans based on that dog's preference. I see a lot of senior labs who will take your finger off for a treat. You can hide anything in that treat, and they have no clue that you've just given them medications. Obviously, a dog like that is going to be a much better candidate for multimodal pain management versus a Chihuahua who barely eats their food, eats around any kind of pill that you try to hide, and has to be forced pills. A dog like that may not manage well with multimodal pain management. The last thing we want to do is have their last days be filled with owners forcing pills down their throat. That does not improve their quality of life. When we talk about multimodal pain management, one of the first things that I will do for joint pain is I'm going to reach for a joint supplement, something that has glucosamine and chondroitin. There are so many supplements out there. You can go to PetSmart and spend an hour looking at all of the different products. I try to stick with some of the more well-known brands because as nutraceuticals, there's not someone that's going through to really prove that what they say is in their medicine is actually in their medicine and in safe amounts and in therapeutic doses. So Cosequin, Dasequin, and Glycoflex tend to be my first choice If you already have a joint supplement and it's working well for your dog, don't change it. A lot of senior foods have these built into their foods. Um, uh, so joint supplements can be very valuable. You're not going to see a huge improvement when you start these. It's a very subtle improvement, but I do have a lot of dogs that improve to the degree that we can decrease their dependency on other medications. For me, the next choice for most of my arthritic senior dogs is going to be an anti-inflammatory like an NSAID. NSAIDs have many benefits because they actually help with inflammation at the cellular level in the joint. What we know about arthritis is that the more inflammation that's occurring in the joint, the more damage and irreversible long-term joint changes we're going to find. So anti-inflammatories are important for actually stopping the process of inflammation or delaying the process of inflammation. There are more side effects with this medication. So we want to make sure that they have good kidney and liver function. There's a small population of Labradors that can have an unpredictable adverse reaction that leads to liver damage from certain NSAIDs. There's risk of GI issues, including life-threatening GI bowel perforations with this medication. I strongly believe in the importance of it, but it's not candy. It's something that we need to value. We need to balance the benefits of that medications versus the risk. What I'll often do is maybe a 10 to 14 day trial for that dog, see if it improves their quality of life. And if we've decided that it helps, then I want to try to do it at the lowest dose possible to give them the best quality days. And if I'm going to have them on that medication long term, then I'm going to recommend that we do some blood work to make sure that there aren't any liver or kidney issues that may justify changing the dose or using a medication instead of an NSAID. A newer medication that we're using now for chronic pain is gabapentin. Gabapentin is a medication commonly used for nerve pain, cancer pain, and in animals we actually use it for seizures. It is a medication that's really newer in small animal medicine, and the dosing for that medication has a huge range. So I tend to start on the lower side knowing that we can go up as needed. It's valuable because it really helps with the nerve pain. A lot of back dogs, neck dogs, think about when you hurt your neck, that kind of throbbing nerve pain is very, very damaging. And unfortunately, we know that there are things like wind up, which is the idea that when you've experienced chronic pain, you actually develop more pain receptors in your spinal cord, which means that sensations that shouldn't be painful now become more painful because your body is set up to react to stimulus in more painful ways. So gabapentin really helps to kind of block that wind-up mechanism that we see with chronic pain. I do sometimes see sedation with that medication, but again, I usually start at such a low dose that we've got room to go up if we need to, and I try to minimize the side effects. And that's a consideration that we have to have. The final medication that I'll often add is going to be tramadol. We used to reach for this medication sooner, but we know that the metabolism of dogs to tramadol is different than the way that humans and cats metabolize tramadol. So there's really a lot of studies that are showing that tramadol may not be as effective for long-term pain in dogs as we used to think that it is. With that being said, I have dogs that do very well with tramadol. Tramadol is an opiate-like pain medication that actually helps with the sensation of pain. So look at these combinations of meds that we're doing. We've got a joint supplement to help with joints health. We've got an anti-inflammatory to actually help with the cellular process of inflammation. We've got gabapentin, which helps to block the nerve signals and the amplification of chronic pain. And now we've got a medication that actually affects the impression and concept and mental feeling of pain. By combining all of these medications, we can lower the doses and therefore lower the side effects of each of these medications. We also find there's a lot of synergy. So when you give these meds in combination, they work better together. I think it's important not to have a cookie cutter cooking recipe approach to pain management in dogs, because giving 16 pills to one pet may be very different than the way that we need to medicate and manage another pet. We've got to look at the whole picture. Do they take pills well? Do they have side effects? Are they having better quality of life? Are they having more use of their muscles and getting out and getting more exercise on this protocol of medications? Another thing that we can move to is an injection called Adequan. Adequan is going to work in ways that are similar to glucosamine and chondroitin, but it seems to, in my experience, work better for certain types of joint pain. So it's given as an injection that we give in increasing. We've got to do a maintenance protocol, and then, we've got to do a startup protocol and then a maintenance protocol. But I'm seeing a lot of improvement in quality of life with Adequan injections. One of the newer modalities is laser therapy. Laser therapy uses photomodulation to change the way that inflammation is occurring in several ways. It can be used at certain wavelengths to help with the perception of pain. It can be used at other wavelengths to help with the actual process of inflammation. That is another modality that I find can be used in combination with a lot of other treatment protocols to really improve pets' response to treatment for arthritis. The bottom line is that it's important that we take care of our senior pets. If you have any questions or you feel like you're seeing some subtle signs of pain and arthritis in your senior dog, I would love to come to your home and do an exam. Sometimes we find conditions that need to be diagnosed with an x-ray, and sometimes we find conditions that are best managed with an orthopedic surgery like a torn cruciate. And these are things that I want to work with you and with your regular veterinarian to help your pet get the care that they deserve. Acupuncture, I meant to mention that. That's another thing that can help with certain types of arthritis or neck back pain. So I would love to hear your feedback on how you knew your senior pet was showing signs of aging. And if there's any questions that you have, I'd love for you to reach out to me and just let me know how we can help your pet age with dignity and give them the best quality of life that we can. It's an honor to know senior pets and to have senior pets. And anything I can do to acknowledge and just encourage that relationship is very important to me. Again, my name's Marlo Ball with No Place Like Home, AR Vet House Calls, and give me a call if there's something I can do to help.